Dear patients, if you have myopia, okay, let me not speak big grammar. If you're far-sighted, nearsighted, or you have astigmatism, in fact, I'm just saying if you need glasses to see, I'm not talking about those that need glasses to read. Researchers and scientists have finally remembered you. You might not need to wear glasses, contact lens, or go for LASIK surgery again. There is a new invention now to help you see without surgery. Now, this is it. You guys know that the traditional method of treating myopia, hyperopia, or astigmatism in the hospital has always involved the method of prescription of glasses, prescription of contact lenses, and LASIK surgery, depending on the one you can afford. Because I was reading some health articles, recent researches and inventions, and I found out that people can actually do without glasses. Or if you have the money, there is an invention now for the permanent treatment of myopia, hyperopia, and astigmatism. This involves the use of a low electrical current which is placed in front of your eyes with a special kind of contact lens. Now, why is it placed in front of your eyes? You know this front part of your eyes, this part that you call black, just like what you can see on the screen, we call it the cornea. This cornea contributes about 40% of the reason why you can see, because it is the first structure of the eyes that bends light. Without this cornea, even when the back of your eyes is healthy, if your cornea cannot refract light properly, it can lead to myopia, hyperopia, or astigmatism. That is why when you come to the hospital as a myopic, hyperopic, or astigmatic patient, the first line of action is that we'll give you glasses. What these glasses does that it will not act like the first structure of the eyes that will not bend the light so that you can be able to see before it will not finally enter your eyes. That is why in this new invention, the contact lens and the electrical current is placed in front of the eyes. That is the cornea, because this part of your eyes plays a major role in vision. At some point, some of you started complaining, oh, I don't like glasses, oh, I don't like glasses. Okay, we'll now say, let us be using contact lens. Now, some of you also complain that you don't like contact lens. Apart from the fact that some of you complain that you don't like contact lens, we also cannot give everybody contact lens, because contact lens is contraindicated for patients with pterygium. We can't give it with people with severe dry eye syndrome. We can't give it to people with severe conjunctivitis. And some of you also complained of LASIK surgery because it is kind of painful. Now, the good news is that this electrical method now does not require laser. It is less invasive and painless. Unlike the LASIK surgery that involves permanent reshaping of the front part of the eyes, that is the cornea, this method now does not need laser surgery to reshape it. What it requires is a special kind of contact lens placed in front of the eyes with a low electrical current, which naturally activates the corneal cells, which causes reorganization of the collagen fibers in your eyes, and this causes a natural form of healing and thereby reshaping the front part of your eyes so that this front part of your eyes can be able to bend light properly. According to this article I read, few people whom they've tried this method on came out very happy, because after 4 days of undergoing this procedure, their vision became very clear and improved with less complication. The sad news here for my patients in Nigeria is that this invention has not reached Nigeria, and not all countries are currently practicing it. But if you know that you have money, you are buoyant enough, you don't like glasses, especially those of you that are wearing up to -15, up to -10, up to -8 in your eyes, and you know you can afford it, you can actually go for this new invention so that you will say bye-bye to glasses. I'll make more researches to find out countries that have started practicing this new invention, as well as the hospital, so that you can go there and have your eyes refixed. See you in my next video. Bye.